Dr. Rebound here. Let's do our medical term of the day. I get a lot of people with rashes, and some rashes are easier than others to identify. I have a problem at times with my grandson being sent out of school, sent out of wrestling practice for what they term ringworm, which is not actually ringworm. So today I want to do ringworm and provide some pictures and information on what it is and what we do about it. Ringworm, the official name is Tinea Corporis. Ringworm is not actually a worm. Ringworm is a fungus infection uh, in the skin. Now, they name it different depending on where it is. If you have the tinea on your feet, that's Tinea pedis. If you have it in your groin, that's Tinea Corporis. If you have it on your head or scalp, um, that's Tinea capitis. Had a brain death right there for a minute. But on anywhere on the body is Tinea corporis, and it typically presents as looking like a raised, reddish, circular type lesion. May have some central clearing, and the raised borders may be a little more elevated and distinct than the rest of the skin. Treatment, why, or let's go back to how easily this is passed along. They really frown on this in wrestling because skin to skin contact can spread this. It is more prevalent in warm, moist environments and warm, moist climates because funguses do not like dry. So, one of the treatment plans is to keep the area dry, especially in the groin and all. If you can powder it and keep it dry, that'll go a long way to curing it. Other treatments for this include basically antifungal medications, most of which are over the counter now. Lamisil, Lotrimin, there's several antifungals, and that should take care of the problem. In really, really bad cases, you could do some oral antifungals, but these have some complications and some potential organ toxicity that we would rather not deal with on something simple like Tinea corporis. So there you have our medical term of the day, Tinea corporis.